feel free to interrupt anytime if you have any questions as I go. I have a short presentation, but I'm hoping also that everyone will have questions either as we go. You're welcome to interrupt me or at the end. So I'm going to go ahead and share my screen, and I have just a few slides as well here. So today I want to talk about our new health studies program at University of the Pacific. And health studies is intended to be a program that's preparing students for non-clinical careers in healthcare. And I think this is really important in part too, because students are often very aware of the more clinical programs, but they're often not as aware of the many non-clinical careers that you can have in healthcare as well. Healthcare needs people, of course, not just to be clinicians, but also to facilitate interactions between patients and clinicians, and to promote health within communities, and do many of these other, and administer healthcare institutions, many of these other types of jobs. And a lot of that requires people who are specialists in human behavior and human interaction and human communication, right? And particularly in a health context. And more often than not, these non-clinical careers have drawn from students who major in social sciences and humanities. But what health studies is intended to do at University of the Pacific is take those social science and humanities classes and give them a health focus, right? So that then you're not just, say, majoring in English and going on to do health communication, but you're actually you're taking English classes that focus specifically on how to communicate ideas around health, right? So it gives students a sort of leg up in that field, which is a very fast growing field right now in terms of these non-clinical careers in healthcare. And the health studies program will have both a Bachelor of Arts and a Bachelor of Science, although both of them are primarily focused on social sciences and also some humanities courses as well. But the Bachelor of Science will have also classes in either human biology or data analysis skills, and students can choose whether to focus more on human biology or more on data analysis. But most of the classes will still be in the social sciences and humanities. So that's a sort of program in a nutshell. Just to think about where this is going, our goal here is to think about careers and things like health education. And I just put up a couple sort of ideas about what we envision students doing. Health education could include things like persuasive health campaigns, right? There's a real need to have people who can communicate these ideas about things like vaccination to communities and to the general public, right? In ways that people can hear effectively. And as we all know, there's a lot of research showing that the way that you communicate makes a huge difference for these kind of things. So health education, learning about that background, being an expert in and knowing how to communicate about health. Data analysis, health data analysis is a huge growing field right now. There's a lot of health data out there, and having people with data analysis skills who are working behind the scenes to look at best practices, for example, in hospitals and other healthcare facilities, right? Public policy, we certainly see the need for public policy right now, right? In terms of the current pandemic, right? Having public policies that help people do things like wear masks, vaccinate, right? Things like that. So helping lawmakers come up with these types of policies, and also addressing health inequities. Again, very relevant and during the pandemic, health inequities that are based on culture, race, ethnicity, gender, social class, right? All these sorts of different inequities, learning about them and understanding, and then helping healthcare institutions and communities address these inequalities. And then social work as well. This is a great major for students that might be interested in doing social work in a healthcare setting, right? Which is also, again, a huge growing need for social workers in healthcare settings. And then finally, health leadership is more along the lines of business skills, bringing business skills into the healthcare industry, which can include everything from administration to marketing and public relations work, right? So all of these, again, would be classes in these different disciplines that focus on these issues, but that have a healthcare focus. Just briefly, and this is on the website as well, so you can find it on the website. but there's a lot of growth in this area. As we know, California is going to face a huge shortage of healthcare workers in the next 4 or 5 years. The projections that they've made are quite big. And some of these will be clinical, but also a lot of them will be non-clinical as well, right? So we have on the website 18.5% expected growth in health studies related occupations through 2026 in California, 15% expected growth in health studies related occupations nationally, and 43,000 medical and health service manager job openings just in California in the next 6 years. Okay, healthcare managers are often people who help also coordinate all the different, when someone is in the hospital, often they have doctors and social workers and a lot of different medical specialists, and healthcare managers often help them coordinate all of them. So a lot of those types of jobs that involve facilitating clinical interactions. So I just wanted to talk about a few alumni that we have that are working in these fields. Now, of course, this is a new major. So these alumni are students who had a different major at the time they were here, but they took some of these classes that were already being developed at the time that focused on health. So for example, Kelsey is an English major. She was an English major. She's graduated now, and she works as a technical communicator for Blue Shield. And she was just talking to our students the other day and talking about how she manages large projects with huge amounts of documents, right? Because Blue Shield has everything documented somewhere. And so she goes through that process and works with a group of people. So she also does management things. Interdisciplinary studies, English and health, yes. So it's interdisciplinary. It is an interdisciplinary major, right? And we'll go through some actual classes. We'll talk about the curriculum in a little bit more detail as we go. So yes, so she manages large groups of people who process large amounts of documentation at Blue Shield, and they often have to discuss how to make changes. If policies change or laws change or practices change, then you have to go through and change all the documentation, and you're often working as a team, or if you have some new area that needs documentation. So she really enjoys her work. That's one example of a health studies career. And then another one is a student, Carrie Balthrop, who is a development and culture change major, and she works in health education, right, for the Contra Costa Health Services. And she recently, she was working on a tobacco campaign, for example. So she was talking in the community and working on how to communicate tobacco policies and best practices around tobacco in a community setting. Right, so that was her job. So these are just some examples of careers and students who have gone into these careers. All right, so let's talk about the curriculum a little bit more, right? The health studies curriculum has, again, classes from a variety of different disciplines. It's an interdisciplinary curriculum. And these are just some ideas about the sort of things that students will learn. So they'll learn, for example, how laws, policies, systems, organizations, interpersonal relationships, and individual health behaviors affect the health of individuals and communities. So you're talking about both the individual level and the community level, right? So looking at the group. Public health, for example, often looks at the group as opposed to the individual. I mean, obviously how it affects individuals as well, but they look at group level data and group level practices often. But laws and policies are often talked about in political science, right? And systems and organizations are often talked about in sociology, and interpersonal relationships and communication in that context is often talked about in psychology and communications. And then individual health behaviors and the health of individuals and communities then being an outcome that all of these different disciplines can contribute to in our understanding of what it means to create a healthy individual and a healthy society, right? So then exploring health disparities, as I mentioned earlier as well, right? Compiling and analyzing health data. We have at UOP also a data science minor as well now. And so students can take some of the classes in that minor, and they could also minor in data science as well, in addition to a health studies major. And that would be a very sought after set of skills at this point, at this moment in time, in terms of analyzing data. Learning to communicate effectively in a professional healthcare environment. So the communications department is teaching one of the core classes in the major that talks about how to communicate in a healthcare environment. And then human biology and data analysis. And then we also have 3 concentrations as part of the major. And I'll talk about those in a second, but they are sort of oriented towards particular careers. So I just want to share a brief look at the curriculum. I'm not going to go over all of the classes, and you can also find the classes on the website if you're interested, but I always enjoy being a professor myself. I always enjoy looking at the classes and getting excited at the thought of teaching them or even potentially being in them, right? So it includes core classes that also, the core classes include classes on, for example, what does it mean to be healthy, sort of overview classes, but also things like statistics and research methods and epidemiology, right? All of which start giving students some of those skills in statistics and analyzing data that are so crucial these days. And then also the communication and health class that talks about how to communicate, and an internship, right? Which is also an experiential learning component for students as well. And then a series of science electives where students can choose again between a more sort of biology and chemistry focus or more of a data analysis focus with classes from the computer science department, like Intro to Programming for Data Science and Data Analytics. And then electives that are health focused, from economics to health and exercise science to even religion and philosophy, talking about ethics, right? And sociology, talking about inequality, right? So a wide variety of different electives that speak to these health issues. And then the 3 concentrations, the career-oriented concentrations, are health leadership, health policy, and social services, right? A lot of students are interested in one of these sort of 3 big areas. Health leadership is mostly focused on business skills and business classes, and also has 1 sociology class. And you can see all the classes listed on the website if you're interested. Health policy is political science and economics, right? So looking at how governments interact with economic forces to create these policies, right? And then social services, which is sociology and psychology classes primarily, right? And I'm happy to send these slides to anyone who's interested as well. If you want to share them with students or other people that you know might be interested, you're welcome to do so. And then finally as well, the major will include a required internship as well that will be facilitated by a class as well. There'll be a class associated with the internship. Yes, I will happily post the slides at the end. So the internships then, the internship and experiential learning will have a class as well, so that students both go out and learn in the classroom, go out and learn in the community, and they come back in the classroom and analyze what they've learned. And we're aiming to have internships at healthcare settings and community settings and non-governmental organizations as well, right? So a variety of different ways. We want students to be able to work for, say, Kaiser or Blue Shield, or also or intern there, or also intern at a public health, like at a public, like the folks who are making, like Dr. Maggie Park, right, who's making all the calls in our current pandemic here in San Joaquin, or also working in the community for a non-governmental organization. So we want there to be a variety of options for students. And of course, UOP has a long history of relationships in the community here because of the dental school and the pharmacy school, right, in not only Stockton, but also Sacramento and San Francisco, which we hope to leverage all of these connections as well to get a broad range of internships that students can experience. And then I also wanted to talk about one thing we have right now is the Peer Health Exchange, which is a student volunteer organization right now that's very focused on health education. And I wanted to turn it over to Yona to talk a little bit about this, as she is one of the primary student founders and coordinators of the Peer Health Exchange. Yona?
Thank you, Professor Mathis. Hi, everyone. My name is Yona Nako. I am a senior biochemistry major here at UOP. Currently, I'm working as a co-coordinator and also as an affiliate program manager between health studies and also Peer Health Exchange. In March 2019, I decided to bring Peer Health Exchange at UOP so we could have a chapter at our school, and we have around 20 college undergrad student volunteers so that they have the position as health educator, where they go in Stockton public high schools to teach weekly workshops focusing on substance use, unintended pregnancies, and mental health. And we spend usually the fall semester to train them, conduct weekly trainings, and in spring semester they go and conduct these weekly workshops. Of course, this year we are working remotely, and therefore the health educator, so our student volunteers, will have the opportunity not only to teach those workshops only to Stockton, but also in a more regional level, including Southern California as well. But last year we were mainly partnering with five public high schools in Stockton, and that's a great opportunity. And we are very excited to this year collaborate with health studies and expand the number of volunteers that we have in the program, giving more priority to the health studies new incoming students. And it's great, even though this is a volunteering opportunity, we have the opportunity to gain real experience that many of us are going into, not only healthcare profession, but even in other fields. And that's a great opportunity for all of us to be able to have this mentorship relationship between students in Stockton and also around California.
Okay. Thank you, Yona.
Thank you.
So that's just an example, of course, of one experiential learning experience, right? And there will be many opportunities. Those are still being, that we have many of these already, many of these connections with the university as well, but everything's of course been put on hold a little bit right now because of the pandemic, right? Most of the health organizations are very focused on getting us all through the pandemic. But we're especially looking forward to having many of these opportunities for students when they come next year. All right, so that's the end of the presentation part. I have here also contact details for me and for Yona, and also our website. I'm gonna stop sharing this and then I can send it as well through the chat. And maybe, Scott, there might be a place you could post it as well if anyone is interested.
Yeah, can we also send it through email?
Yes, we can probably also send it through email. I think I can just, let's see, can I do that?
What would you like me to send, Sarah?
The presentation, I was just going to say you can.
Yeah, I can, if you would like to. Okay, great. And yeah, I can send that through email, and definitely get a copy out to everybody so they have all the information. No problem.
Yeah, if we post a link to the video, we could probably also add the presentation next to it.
Okay.
Cool. So that's sort of the bulk of the presentation part. Does anyone have any questions or anything they'd like to ask or talk about with regard to the new program?
Can I be the first to ask a question?
Yeah, go for it.
So I'm Pablo, and I work as a counselor at the Mountain House campus. And many of our students love UOP. I work for San Joaquin Delta College as a counselor. And so my thought is, when I saw and listened to your description, that a lot of people will want to get into the healthcare administration field. Mm-hmm. And I didn't think about the data analysis in healthcare that's specific to that. I think that, when you think about what's happening now with the pandemic and the policies of Obamacare and what's going to happen and what might not, this is a new and emerging field that's yet to be defined. And so Have you already started the process of articulating with Delta the courses? Because many of the prerequisites that you listed there are done at the community college, or would you rather them have most of those done at UOP?
I have not started that process, but I can. I've done it with, I'm also chair of the School of International Studies, and I've done that with our International Studies major, but I've not yet done that with this one. But that's a good thing. I will put it on my agenda, and we can start doing that and thinking about what classes articulate. I mean, I would say probably there would be an expectation that a certain number of upper division electives were taken at UOP, but I certainly would have no objection to students taking a lot of the core classes, certainly statistics and,
Absolutely.
GE requirements and probably the biology class as well.
Quick question about that. I noticed that the biology was a combo class, bio and anatomy. And so most programs at your level, because by definition, the community college are lower division granting institutions, which means we only offer, of course, first and second year courses. We don't offer upper division. But my question is, we have at our college a Bio 33, which is a combo course that's typically used for programs like LVN, licensed vocational nurse. But most of the nursing and transfer health requirements in certain areas will require the split anatomy and physiology, anatomy 4-unit, physiology 5-unit. Which one do you think you'd be leaning towards? Because I think this is a good option for students.
Yeah, we will not require a split class. The goal of this major is to be primarily social sciences and humanities. Yeah. And the goal of the BS option is actually partly for students who may start in a more clinical as well and decide that they want to transfer into a less clinical field, right?
Yeah.
So part of the goal behind the BS also is to acknowledge the science classes that some students do have, but the only required biology class is a GE level biology class at UOP. It's not a major level class. We very specifically wanted to not require, because sometimes the major level science classes are challenging for students to complete. We wanted to require GE level biology classes, right? So it also enables students to take a GE level bio class, and you could transfer it in, and then the social science and humanities classes. And if they want the, and that would be very easy for getting a BA. If they want the BS, then they need additional science classes. But again, you can focus on data analysis as well as focusing on biology. Human biology, right?
So sorry, one more question, because it's
yeah, go for it.
So a lot of times these majors lead into management information systems majors, business related to health. Mm-hmm. And so then some of those majors require the BS, which implies that you're going to have some science courses. So for those majors that you are data analysis at the upper division level, will they take more science?
The science requirement is not that large, because it's also social science is also, but so at this point, I think it's 3 classes, right? So we do advise students, and we will write this in and make it very clear in advising, that if they want to go into one of the careers that has a very specific set of science requirements, that they should know that ahead of time, right? And we're also thinking of creating, I know that the School of Health Sciences right now has been talking to us about creating a minor that is more science heavy, that is specifically for students who want to keep open the option of going into a clinical career, or, for example, go into one of these other master's degree programs that does require certain science classes, right? But we also want to make the major accessible to those who will go into something more like social services that doesn't require any science classes. So it has to have a little bit of flexibility there, right? But we will have to primarily do that through careful advising for students that want to keep that option open of going into the more heavily science. It's not intended to be a heavy science major as it is.
And that's good. There's a lot of students that are not heavy in science and want to work in health field.
Yeah.
And I'm sure that's why you designed it. With your permission, Vicki and I would like to send your presentation that you put, we'd like to send it to the rest of the counselors at Delta College, if that's okay.
Absolutely. We'd love that. That would be great.
Thank you. Thank you.
I echo what Pablo said. If an articulation agreement could be started, developed,
Okay.
that just it's just stronger because our students then can see that the classes they're taking at Delta
Yep.
will be accepted with you, and therefore it's a much more enticing perspective of going to your campus straight from Delta.
Yep. Absolutely. Absolutely.
And I know that, thank you, Vicki. And I know that, Sarah, we can work with Dave Hamlet
Yep.
over in our transfer admissions. And he can help us out with that articulation agreement and where to go and how to start that.
Yep.
We all know Dave. He's great.
Dave's a
love
good guy.
Dave.
Good guy.
Yes. And like I said, I've worked with him in the past with international studies. So yeah, I could definitely do that. Cool. Anyone have any other questions or comments or suggestions? I see we have a few people, Elisa and Chris as well. Oh, Vicki, you had a question? Did I see you unmute?
I just had a comment. I love that you're sharing this information with us. I love that it was open. And the fact that you have options, the fact that if somebody wants to be in the health field, not necessarily in the clinical setting, there's options for this. So I love the fact that you're going to email us your PowerPoint, because then we can incorporate this not only with our colleagues, but also share that with the students whenever they have questions or whenever they ask, well, what can I do with something like this? We already have it from you in what your area, your interest, your philosophy was in developing this. So Jonah, thank you. And everybody that worked on this. Also, if you could, the recording of this, I don't know how long the recordings last, but this would be awesome to forward to students if they were interested.
Okay, yeah, definitely, will do. Great. Well, Vicki, I have your email because you emailed earlier, so I could also email you a link once I have a link.
Perfect, thank you.
Cool. Anyone else have any questions? Anything else you want me to talk about or share about the program? Scott has shared his email into the chat as well.
Yeah, if anybody's interested or any other questions come to mind, feel free, send them my way, and I'll work with Sarah here, and we'll definitely get all your questions answered. So I appreciate everybody coming out tonight.
And if you're a student and you want to talk about the student experience, you're welcome to email Yona as well.
I can also include my mail on the chat as well.
Cool.
Ms. Yona, do you have like a flyer or something that we can send to the counselors? And so I can envision this major. And you guys didn't design it like this. You designed it with a social science perspective for some really cool reasons, because there's a lot of people that are social science majors that want to get into health. But the reason I bring that up with the whole the flyer is that we do also have a population of students that started in nursing, but then decided that the sciences were not what they liked.
Mm-hmm.
But they still want to work in the health field, and they're trying to find their niche, right?
Yep.
So I can see this as a good entry point for students to have that as another option for them to look at. But we need basically some flyer or something with your name, and if you're serving as a contact for them so they can speak to the student experience, that would be great.
Yep. That sounds
something to
great.
think about.
I don't think Yona is on the flyer, but there is a flyer, right, that I just sent. Oops, you know what? I sent it actually to just one person because, sorry, hold on, let me try it again. Go ahead.
I was just gonna say, I have the presentation and the one sheet, Sarah, if you'd like to send that to Vicki.
I just did. I sent it through the chat. It just, it was Zoom defaults to the last. So let me just send it again.
Okay.
But Yona, you wanted to say something?
Yeah, I just wanted to say that I also have the flyer that we used on another open house, if you want me to include that one.
There we go. Actually, I just sent it. It's the one sheet. We call it a one sheet.
Yeah.
So if you see it there, it should show up. That's our flyer. Like I said, though, I don't think it has Yona on it, but I think it has my name on it in terms of contact. I can also refer anyone to Yona if they want to speak to a student.
Yep.
So cool. That's great. All right. Well, shall we call it a day and let everyone get back to their evening? And thank you all for coming. It was good to meet all of you.
Nice to meet you. Thank you.
Bye-bye.
Thank you, everyone.
Bye.
Thank you so much.
Thank you for
Bye-bye.
attending. Bye.